I just realised that when I was talking to you about the epidural, I missed out a couple of really important things that I should have told you about. So I want to go back over those and just mention that now. So we just going back slightly, if you remember, we talked about if someone has an epidural, they need to have their blood pressure checked regularly, they need to have a drip in their hand, they need to be on the electrical monitor, and they'll need to have a catheter. But what I should have also mentioned to you is that you'll also have something that we call a PCA, Patient-Controlled Analgesia, because the anaesthetist initially, when they site the epidural, they'll put in the epidural itself, and the epidural solution is then, they give you a low-grade block of this epidural solution that's continuous. It's continuously going into you, whether you're awake or whether you're asleep. So hopefully that helps you to remain quite numb in that middle segment there. But for some people, that isn't always 100% effective. For some people, they can feel little pockets of pain, in particular areas. And so the PCA, patient-controlled analgesia, can be really good to sort of just deal with that as it comes. Yeah. So when you use your PCA, you can't overdose on it, because you can only give yourself there's a maximum dose you can give every 15 minutes. But if you were to feel some discomfort, say on one particular side, say on your left side, if you press the PCA, then gently sort of rolled onto it a little bit, you might find that helps to ease that sensation. So then you might leave that then goes, you leave that, and then a bit later you might feel some discomfort somewhere else, and you might press the PCA. The main body of the epidural itself is doing a fabulous job, but just sometimes you just need that little bit extra here and there. If you were to keep pressing this, then obviously the block itself, the whole block, becomes a little bit more dense, so it becomes less likely that you can kneel up onto all fours over the back of the bed. You become a bit more sort of like heavy in your legs. But if you're feeling uncomfortable, then that's absolutely, of course, the right thing to do. But it's that's entirely up to you. And people do say, oh, if the epidural is really working well, will I feel when it's time to push? Sometimes you don't feel a pushy feeling, because you don't feel an urge to push, because that's the whole point of it. But you will always feel pressure. You'll always know when you should push. So we'll be able to help you, even if the block is really good, you'll know when you need to push. So we'll be able to help you with guiding you to be helping you to birth your baby with that. So the other thing to say about the epidurals, we mentioned about the PCA, but the other thing to say is, if you were to go to theatre and need a caesarean section or any procedure in theatre, if you already have an epidural on board that's working, then they just have ways to top it up slightly to make it right for this new experience, and use that in theatre. But if you didn't already have an epidural, then you wouldn't be given an epidural in theatre. Not usually. You'd be given what's called a spinal block. Principally, as what I've described to you so far, it's quite similar. It goes in a slightly different place, but the most important difference is, whereas I showed you this before, this very small bit of flexible straw that sits inside of you, when you have a spinal block, there isn't a remaining bit of flexible straw. It's a one-off administration. It's good. It's really effective, but it has a shelf life. So it's often really, quick, effective, and a great tool for a theatre procedure, but it will start to wear off after about 4 hours or so. So therefore, that's why for labour, epidurals are better, because although they're not always 100% effective, it will last to infinity and beyond. But when you are, having a procedure in theatre, the spinal block, if you haven't already got an epidural that's working, is the optimum tool, because it's quick, it's effective, and it's just what you need for that experience. Okay, so that's all I wanted to say on that one.